Welcome to Velocity, the Vista Chamber podcast. I'm your host, Rachel Beld, and it's my privilege to interview the movers, shakers, and change makers impacting the Vista community and beyond. Today, I am joined by Vista Mayor John Franklin. Elected on a platform focusing on solutions to address homelessness and improve public safety, Mayor John Franklin was a leader in the creation of Vista's award-winning homelessness strategic plan. First elected to the Vista Irrigation Board of Directors in 2012 and elected to the Vista City Council in 2014, Mayor Franklin was appointed by his colleagues to serve as deputy mayor in 2017, 2019, and 2022. He is the fourth directly elected mayor of the city of Vista. Mayor Franklin is also a strong believer in fiscally responsible and transparent government and has worked to improve Vista's financial position while on the city council. Mayor Franklin's also been a strong advocate for improving traffic flows in our community to get residents home safer and faster. In addition to his core priorities, Franklin has worked to eliminate blight in Vista, improve our parks, acquire new public park lands, and promote public art in our community. In support of the city's long-term efforts to revitalize downtown and the Santa Fe corridor, he's worked to create a business-friendly climate to attract new investments and employers to Vista. A graduate of the American University in Washington, D.C., Franklin served nearly a decade as a congressional policy advisor before opening his own small business in Vista. He and his wife, Shauna, are residents in the Vista Shadow Ridge area. Mayor Franklin, thank you for being here.
Thanks for having me, Rachel.
Yeah, I'm so glad you could join us. I know you have a very busy schedule, so I appreciate you fitting us in. So I want to jump in and learn a little bit about your past.
Sure.
And so I'm curious, where did you grow up?
I grew up in Kansas.
Kansas, okay.
Yeah.
So how did you end up in Vista?
Well,
tell me about that journey.
Sure. So I grew up in Leawood, Kansas, which is part of the Kansas City metro area. And then when I was about 18 years old, I moved to the Missouri side of Kansas City, is bisected by the state line. So I moved into Missouri. I did my first 2 years of school at the University of Missouri, Kansas City campus. And I was actually in school at UMKC when September 11th happened. And that had an incredible impact on me psychologically and really made me evaluate what I wanted to do with my life. Spent a lot of weeks in my apartment watching the news, I think as we all did at that time, just in disbelief about what was happening to us as a nation. And of course, the enormous feeling of solidarity that we had as Americans and patriotism and the anger and frustration about being attacked as a nation. All those things weighed on me and I think really impelled me to pursue a career in public service, which was something I already had an interest in from the time I was young. I've kind of always been interested in politics. It's how could you not be fascinated by who gets what and how? At least that's how my poli-sci 101 professor described what politics is all about. And it really is fundamentally about how we divide resources. And so I took advantage of the opportunity to be an intern and represent the Associated Students of the University of Missouri. And I went to Jefferson City, Missouri, and I lobbied at the state capitol on behalf of some things that the Student Body Association had come up with as legislative priorities. And so I traipsed around the halls of the state capitol. I worked a little bit on some campaigns for the state house. And then I decided that I liked politics and wanted to make a career of it. I went to Washington, D.C., to finish my education and graduate from the American University. And I had an opportunity to intern in the office of the House Majority Whip, which I actually had if you look at the West Front, which is kind of the part of the Capitol that faces the National Mall, I had one of the big arched windows. My desk was pushed right up against, and I was looking right down at the Washington Monument from the Capitol building.
Wow.
I was in a little tiny hallway. It wasn't a grand space from the inside of the building. From the outside, it's pretty magnificent, and the view was excellent. But it was a place where an intern was warehoused, believe it or not. And then I got a job working with Congressman Darrell Issa 20 years ago. I was hired to answer the mail, and so I spent a lot of hours. The legislative correspondent is the person who answers all the mail on Capitol Hill. And it is a big job because every congressman on average receives about 3,000 pieces of correspondence every month. And
Wow.
so it was my job to work with the congressman and his staff to make sure that I understood his positions and to draft responses that were thoughtful and to make sure the congressman approved of those responses. So I developed a love for corresponding with Americans about the issues of the day. And I started working on behalf of the people of Vista 20 years ago from Washington, D.C. And it was in 2003 when I first traveled to Vista. I stayed at the La Quinta. It was one of the only places to stay in Vista. It's not my favorite place to recommend as a hotel these days, I'm sorry to say. We're always encouraging ownership there to improve, but we've got some great new hotels as a consequence of city leadership. I know you've been involved as a chamber executive to make some of those things come to reality, and before that, you were part of the economic development team for the city. So I know you know the history of that very well. But when I moved out, I was working for the congressman. In 2012, I ran for a seat on the water board. I wanted to find another way to be involved and to serve the community. And when I got elected to the water board, I left working for the congressman and the federal government, and I started my own business. And I met my wife a year before that, and we rented an office suite where we're still at to this day. I think we've been there for about 12 years now, right across the hall from the congressman's offices. And we work with elected leaders and nonprofit organizations and private businesses. We do marketing, we do websites, we do direct mailing campaigns. We're basically an advertising agency. So that's who I am, what I do, and a little snapshot of how I got where I am. 2 years after I got elected to the water board, there was an opportunity to run for the city council. And so I ran and was elected about 9 years ago and served for 8 years as a member of the council. And then when Mayor Ritter decided that she was not going to seek reelection, I looked around and realized I was the most senior member of the council. And I decided I would run for mayor. And I really decided, I just spent the last hour on a call with the Alliance for Regional Solutions talking about homelessness. Mm-hmm. They're our North County sort of version of the continuum of care. And they're a contracting agency that divides money up for the different service providers. And we actually use that agency to let contracts on behalf of the city of Vista for shelter beds and other service providers. But homelessness is the issue of our day. And it's the thing that I said, if I have an opportunity to lead on this subject, then I'll continue to serve. Otherwise, I think, 8 years is probably enough. And it's time for somebody else to serve. But I wanted to make a difference on this one thing. And so I have really tried to be the leader that has dived into this issue with, maybe more depth than most would dare to. And I've learned a lot. And every day I realize there's a lot more to learn.
Great. Well, I have some questions about homelessness in a bit. But I wanted to ask you, so when you were in D.C. and you're working on correspondence, are those letters? Are they emails? Yeah. I'm very curious just about were you writing letters? Were you typing? I'm very curious about what function you actually.
So generally speaking, if you write an actual letter to your congressman, you're probably going to get an actual letter back.
Right.
If you send an email, you're going to get an email back.
Okay, that makes sense.
We actually, Congressman Issa is a believer in, he's considered a technology leader in Congress.
Okay.
And I love technology. And I was proud. Congressman Issa came to me and he said, we're going to get rid of all this paper. We had huge filing cabinets. Every congressional office was full of an incredible number of filing cabinets because, of course, before computers, everything was on paper.
Right.
And Congress is an institution that's, 240 some years old now. And so a lot of old office history there. But we were the first to scan digitally all of our incoming mail.
Oh, wow.
And then we computerized it. We used optical character recognition to not only to look for major subject matter, but to look for the contact information so that we could more efficiently generate responses that were correct. Because typically what happens is of the 3,000 letters that you get in a month, generally speaking, about 300 of them will be all on the same subject.
Right.
And it may be like immigration was a big issue 20 years ago. It still is, of course. There may be 12 different subsets we may have, 12 letters geared towards immigration that address different subset issues. And if someone writes a letter that asks a question that's not been asked before, then it would be my job to draft a letter that specifically answers that question.
Okay. Take
it to the congressman's staff members, his chief of staff, and then ultimately to the congressman to approve to answer that specific question. So you might be getting a form letter back from your congressman, but know that most members of Congress take great care to make sure that the the response is specific to the question that's being asked. You're probably not the only person to have that specific question, though, because every member of Congress represents about 750,000 people.
Right.
So, and then, you learn about the policy issues by answering these letters. And I was promoted after a year and a half to be a legislative assistant, which is a policy advisor. And I worked with the congressman to take his ideas and work with our legislative council, the attorneys that actually draft bills. And I was sort of the liaison between the congressman and legislative council to draft legislation that was introduced, and also to meet with members of the community. I got to meet with our auto dealers and our Pizza Hut franchisees association. Every week, I would take about 40 meetings with different business groups. Most were folks who lived right here in the community, who had taken the time to travel to Washington, D.C., to communicate with their congressman about issues of the day that were important to their industries. So not only did I have this amazing opportunity to get to be the go-between and corresponding with 3,000 constituents, but then as I progressed in my career, I got to have meetings with and meet the business leaders in our community and understand the challenges that their businesses faced. And oftentimes it would be maybe a mother whose child had died of cancer and didn't get the resources that they needed. And there were a lot of incredible stories like that really made you realize how important the work was.
Yeah.
And it's just an incredible opportunity to serve. And I've, I get a kind of a high from serving people. I love whether it's somebody, a woman called me yesterday, and I'm getting a lot of phone calls right now from families that are suffering from homelessness. Right. And whether it's that level of service or it's somebody who is having trouble with the building department. I actually really enjoy being of service to people. I think it's the most fun thing that any of us can do is serve others. And so I love the job of being mayor because I get to be helpful, and that's a lot of fun.
Yeah, that's great. I'm fascinated by the example of how I think about oftentimes how different levels of government interact with the constituents that they serve. So it's fascinating to me to think about a representative in DC receiving all of these pieces of correspondence. I get between 300 and 400 emails a day. Mm-hmm. Just me, just Rachel at the chamber, the lady over there, 300 to 400. So I can't even imagine the volume of correspondence. Now, thankfully, some of those I can just delete. Yeah. So, but I can't, it's just fascinating to me, the process by which the average person, the average business, the average whoever can connect with their elected. So thanks for taking a minute for that little segue and digging in, because I think that's just so fascinating. That's one of the things the chamber that we try to do is to connect our business members with all levels of government in whatever way we can and to advocate for them. So I think that's fascinating.
What's great about being the mayor or being a council person is there's still enough time in the day to take all of someone's calling me as we speak right now. But there's still enough time in the day to answer the phone. And people call me all the time on my cell phone number, which is 689-2220. They call me every day and they go, "Oh, I didn't think that you would answer the phone personally." Mm-hmm. And, I took the office telephone number off of my business cards. And I said to the staff, I don't want to hand out a line that gets answered by staff or goes to voicemail. Right. I want people to call me directly on my cell phone number. I'll get back to them if I can't take their call. But I always get back to people the same day, or I take their call on the spot. And I love when people are surprised that I answer the phone personally. I mean, there's only 103,000 people in Vista. So I chose Vista specifically because of the size of this city, right? That I could know you as the chamber executive, and I could know the city council people, that I could be involved in the organization of government and the community, that I could really plug in and know people. I wanted that. I did a lot of traveling and living in different places. Community is incredibly important to me. And I looked at Vista and I said, this is a place that I can be a bona fide vested member of the community, and anybody can, because it's the right size community. And so that was incredibly important when I made a real decision to live here. That and it's a beautiful community with a great quality of living. And of course, we have the best weather on earth. Absolutely.
So I have to ask, so the mayor, and people may not know this, but technically it's a part-time gig. Right?
That's right.
So you own a small business.
Yes.
And you're answering the calls when they come in. So is it really a fair representation to say that being mayor is a part-time job. It seems pretty all encompassing to me.
It is. It certainly can take much more of your time. And if you love it like I do, then you don't mind. I have to always thank my wife, Shauna. She is really very sweet to allow me to do this. And I promised her I won't do it forever because it does take a lot of time away from the time that I want to spend with my family. But it's work that is, like I said, it's meaningful and it's enjoyable. And I won't do it my whole life, but for this moment in my life, I'm really honored to have the ability to do it. And I'm really appreciate my wife for letting me do it.
That's awesome. So I have to just also add to the fact about Vista being such a great community. I moved here also 20 years ago in 2003, and I moved here to work for the city of Vista. I worked for another municipality in Texas where I grew up. And when I was deciding whether or not I applied for the job, and there's a whole story behind that. But before I accepted, I was 25. I knew that I'd probably be here a while. I told my parents I'll be there for 2 years, but I knew in my mind, like, this was a big move. And if I'm going to go to this community, I want to be in this community. I want to be engaged in my community. I want to be part of it. So learning about all of the things that were offered and all of the research. So I can definitely connect with your story about just making sure that Vista is the right fit for you and that you could get to know everybody. And, my family jokes that I'm a joiner. I join all the things. And I'm proud of that. I take that as a compliment because being involved and connected to my community is really important to me. So I share that with you. So, okay. Next question I want to ask you. We mentioned homelessness. We talked about it in the intro. Tell me about the work that the city's done and the work specifically that you and the city have done regarding this issue. Because it's not a Vista specific issue. It's much bigger than that. And it's very complex. So tell me a little bit about what's been done and what can be done.
How much time have you got?
I know this is a short interview and we can barely scratch the surface. Let
me try to encapsulate the time that we have. To begin with, about 5 years ago, I really begun to notice the prevalence and growth of homelessness in Vista. And 9 years ago, when I was first elected to the council, I did not notice very many people living unsheltered in our city. About 5 years ago, maybe 6 years ago, I really started to see the problem grow. And I realized that it was something that we needed to take very seriously. And I asked my colleagues on the council to make it the number one priority of the city. We get together every beginning of every new council, which is every 2 years, and we set goals for that 2-year period of time. And so I asked the council to make it the number one goal of the city to solve the causes and symptoms of homelessness in our city. And so making that the number one goal of our city, the natural progression from that was to try to make a plan. And that was the genesis of our strategic plan to solve homelessness. And we were honored to be recognized nationally for that plan. And I'll tell you, there wasn't necessarily a lot of secret sauce to the plan. It was simply that we held a number of hearings in the community, geographically all throughout the city, and we invited our residents, our service providers, and all the leaders of all kinds of different organizations. Everybody was invited to come and to give us ideas. And we literally incorporated every single idea that we received. And there was just one. There was one idea that we didn't. And that was to buy a minivan, drive it around downtown, and ask people if they wanted to get in the minivan for the day and go to the day center for unsheltered people in Oceanside. And nobody had ever done that before. And ultimately, we decided that wasn't we didn't think there was enough merit behind the idea, so we decided not to do that one. But some of the things that we did, and I asked the city to create cityofvista.com/homelessness so that it was easy to get to and find our work on homelessness. Obviously, first and foremost, we obtained shelter beds, which is something that in the past we did not have City of Vista sponsored shelter beds. We have 5 beds at Interfaith. Haven House is the name of the shelter at Interfaith in Escondido. And we have 5 beds at La Posada, which is operated by Catholic Charities. And is about 1.6 miles from the southern end of Vista. It's right next door to the police station on Faraday, if folks are aware of where that is, the Carlsbad Police Station. So it's very close to our community. And And we're actually working right now as a development, and really it's a living document. We're continually evolving. Right now, we're working to do something that's very innovative. Again, this morning I've literally been on Zoom, and before that I was on a phone call with someone else who is a national expert on the problem. And I asked, and I continue to ask, we're building a non-congregate shelter. So right now, you go to the shelter, there's 50 beds in one open room. They call that a congregate shelter.
Right.
But we're building, to my knowledge, I can't be the first, but I'm not aware of another example of a non-congregate shelter. So we're buying 2 apartment buildings. We've gotten some help from the state Senate. Catherine Blakespear has secured some money for us to help us do this, where it's a partnership with the city of Encinitas. A lot of people, we ask people, we've had over 5,000 separate conversations on the streets of Vista with people who are unsheltered. It's approximately 400 unique individuals now over the last about 3 years that we've had these conversations with. But one of the questions that we always ask is, why are you declining to go to the shelter? Because unfortunately, 94% of the people that we ask to go to the shelter decline to go. Overwhelmingly, people don't want to go. And so we ask them, why do you not want to go? I can't take my wife or my girlfriend. I can't take my dog. I snore, and I've been asked to leave because I snore, I don't feel safe. I was attacked when I was at the shelter before, and I'm afraid somebody's going to attack me. I'm afraid my property will be stolen. A lot of these difficulties are addressed when you have a bedroom of your own that you can close the door on for the night and lock yourself in. And, how many of us would feel like we could get a good night's rest if we were in a room with 50 strangers who, many of whom are suffering from mental illness, or addiction disorders rather. So there's some very obvious reasons that we can see. And I'm going to be honest with you, it's a total experiment. One of the things that I've asked repeatedly is, why have none of the other shelter providers tried this yet?
Probably because of cost.
It certainly costs more. There's no doubt about that. But, the number one driver is actually staffing, right? When we look at the cost of providing shelter, the real estate in and of itself isn't necessarily the significant driver. It's really the staff. So there must be reasons, or maybe there aren't. We're going to find out. It's an experiment, and it's one of the reasons I said let's search the state and find out who's done it before. We haven't brought this online yet, but we've got to be willing to. 2 things: we have to be willing to experiment, and we have to be willing to confess failure as soon as we realize that there's a failure. One of the things government does a horrible job of, we cannot admit when we fail. We start a program, and then that program has a constituency: people who are served by the program, employees of the program, contractors that receive money through the program, politicians, council people, assembly people, whoever it is, who are the ones who, wanted the public acclaim for creating the program. They don't want to confess that it's a failure. The sooner we admit our failures, the sooner we can get to the successes, right?
You can reallocate those resources in other ways.
So one of the things I am most committed to is failing publicly, right? If we're not willing to fail publicly, then we have no desire to succeed. And that is so important. And nobody in government wants to fail. But as soon as we admit our failures, we can reinvest our resources into potential successes. So I want to be a leader who is transparent about failure. I want to be a leader who's transparent about data. That's something that was really the focus of my meetings this morning, was about data transparency. In a week from now, I'm going to participate in a press conference with the San Diego County Taxpayers Association. I've been one of the few elected leaders that answered their call to call for greater data transparency. We need to know, and I'll just give you one really simple example. In the last 6 months, we paid for 1,825 bed nights of shelter. And we know that not all of those bed nights of shelter were delivered because, in some cases, because of a COVID outbreak, that diminished capacity in one of the shelters. In other instances, several instances, actually, difficulty staffing. Everyone's having trouble staffing right now. Doesn't matter what the industry is. And so, but I don't know, out of 1,825 bed nights, I don't know, was it 25 nights that weren't delivered? Was it 500 nights that weren't delivered? I don't know if it's a small problem or an enormous problem. And so I'm demanding the quantification numerically of the taxpayers paid for this. I have to know, and I have to be able to account to the taxpayers whether or not we got what we contracted for. And I told the service providers, look, I'm not trying to throw you under the bus here. This is not about, like, I do want our money back. If you didn't give us what we paid for, then you have to give us our money back. But that's even more important than that, because we're trying to solve the problem. I need to know if the beds aren't available, because we need to recalibrate and we need to find other solutions. If we need to bring in a third provider for shelter beds, and obviously we are bringing a third solution in with our own shelter, and we're going to be having a lot of public conversations about who's going to operate it. There will be a request for proposal and a public process to select the operator. And there's going to be a lot of robust debate from the city council about what the rules are going to be. What's the maximum stay? How long can you be there? There's a
this
certain
is in the non-congregate space.
In the non-congregate space, because what we really want to provide with this facility is what's called emergency bridge shelter, and it's called bridge because it's a bridge to permanent housing. If we make this into a permanent environment, then it becomes a small quantity of permanent housing. But what we want to do is we want to get people off of the street, and we want to provide that bridge for them to get into long-term permanent housing. And that's something else the city of Vista is currently working on. And also part of the plan is we have an RFP right now to build 50 units of permanent supportive housing. And, as I've been talking with Dr. Luke Bergman, who's the county's chief mental health officer and the county conservator, one of the things he identified was, he said, permanent supportive housing, there's a different class of housing called board and care. And you have to really get into the taxonomy and the jargon here. Board and care is a little lesser level of care, but he said, we really need more of that right now. We need more addiction recovery beds. And so we're going to continue to recalibrate and ask the questions, exactly which resources are necessary and how do we as a city do our part to provide them. And we're looking at every other city and saying, hey, do your part as well. The bottom line, the solution to homelessness is incredibly simple and incredibly difficult, right? And it's this: if we're not going to help the people who are too sick to know that they're sick, then we are not serious about solving the problem. When we help the people who are too ill to realize that they're ill, we will have solved the problem. But that is the most complicated part of the problem. One of the things I always want to talk about is I'm a strong believer in involuntary treatment for people who are mentally ill and who are addicted. Now, does that mean that every person who's mentally ill or addicted needs to be treated involuntarily? Of course not. It's a very small percentage. But what happens when you have the whole population, 100, for example, for easy math, you have 100 people who are suffering from mental illness or substance abuse disorder, and we help 3 of those people into treatment, maybe even against their will. Now 97 people realize that if they don't accept the help that we're offering, there's a pathway to be helped whether you want the help or whether you don't. And now let's talk about something that's incredibly important, which is protecting everyone's civil liberties. The Constitution says you can't be deprived of your life, your liberty, or property without due process of law. What that means is that there's a trial by jury. You have to have a unanimous jury verdict in order to put somebody into a conservatorship. So to treat somebody on an involuntary basis requires a unanimous jury verdict. And I always ask, and I'd ask every listener, if you served on a jury, would you make a ruling as a juror to take someone's liberty away from them if you didn't think it was absolutely necessary to their health and welfare? I think we're all caring human beings, and I'm sure at least one person on that jury would go, I think that person's capable of taking care of themselves. I'm not going to take their liberty away unless I can see, and all 12 of us can see, that this person's life is destroyed because they're not getting the help that they need. Constitutionally, you have the right to an attorney to defend you in this process. Under the Lanterman-Petrus Short Act, signed in California in 1967, you have the right to a psychiatrist to work with you to make a diagnosis, who's the highest level of mental health professional. You have the right to a patient's right advocate, whose job it is to make sure that you show up in court on time, to make sure that you're properly clothed, that you're clean, that you're able to understand all of the process, to defend and make sure that your rights have been exercised that you're aware of your rights, and you can take full advantage of your rights. Okay. So when you look at all, and then by the way, maximum 1 year. Okay. The conservatorship process lasts for a maximum of 1 year before that individual needs to be brought back into a courtroom and a totally new jury trial. Every 12 months, you have the right to a new trial by jury to determine mental competency. And again, we don't need to do this for but a very small percentage. If we can help the people who are the most sick to get off the streets. And, I was one of the first people about probably 3 years ago to start talking about anosognosia. It's a Latin term. It means to not know a disease. And I'm starting to hear this term more and more frequently. And people are understanding that anosognosia is the state of being sick, but being sick mentally to where one does not recognize that they are sick and would benefit from treatment. And this is so important. If I'm addicted to heroin and every day I go out and I destroy my body, in my mind in pursuit of heroin, or if I'm schizophrenic or psychotic or severely bipolar, then I may not realize that I would benefit from treatment. And there are real reasons that should be talked about and deserve to be talked about why people don't want to be treated or don't want to take medicines. But we need to make decisions as a society about whether somebody is actually better served by living and dying on the streets in squalid, disgusting conditions. And if you take the time like I have to go call on people in the encampments to see their bodies covered with sores, to see a woman who I encountered in front of the Vista Paint building at Sycamore, who told me that she lived on the second floor. In fact, she owned the building, according to her. There's no second floor of this building. She was in a drug psychosis, okay? And she had broken her leg on the street. And because she was living on the street, did not pursue medical treatment, her leg looks like this because it was never set. And this is a woman that lives in horrible pain every day of her life because when she was injured living outdoors. And for a time, we were having somebody discovered in these encampments probably about once a month who had died of overdose or exposure. And it ebbs and flows, but fentanyl is a huge killer of people. People are dying in these encampments. It's a very unhealthy environment. And I would submit to every human being that's listening, it is not moral, just, or compassionate to allow somebody to live and die in an encampment. It's moral, just, and compassionate to go out and pick up our brothers and sisters in humanity and bring them to the help that they need. This is the answer to the question. People are angry that government's not solving the problem because we all see the problem getting bigger and bigger and bigger. But it comes down to this. Do you have the political will to help the people who are too sick to realize that they're sick? Not 100 out of 100, but maybe 3 out of 100. We have 1,200 people in the county of San Diego, 3.3 million people. Only 1,200 are on a conservatorship right now. And we're only renewing about 300 of those for a 12-month period every year at the moment. So the number of people on conservatorship is getting much lower. We are not serious. We only have one judge in the whole county for the Superior Court, one judge that does mental competency. We spent in like 2021, we spent almost $80,000 in housing and homelessness programs through the state of California budget for every single unsheltered person. We reported as a state 125,000 unsheltered persons to the federal government. We need to take some of the funds that are not finding the mark, and we need to divert those resources into the court system so that we can pay for the defense counsel, we can pay for the patient's right advocate, pay for the doctors, pay for the courtrooms, and all the necessary services of the court so that we can find, and we need to, and I've been talking with Governor Newsom's staff here locally about supporting his initiative. I'm reviewing it right now, and I think I'm inclined to support the governor. He's going to pursue funding specifically for 10,000 new mental health and addiction treatment beds. When the governor is right on these issues, and of course, the governor and I don't agree on many issues, but on this issue, Governor Newsom is actually really leading the majority party in California, I think, in the right direction. He's calling for more and more treatment on an involuntary basis. Care court is a preparatory for conservatorship. Care court is an outpatient mode of treatment that is ordered by a judge and jury. Care court places a court order on an individual that mandates that they appear for medical appointments, that they take drugs that are prescribed for them by their physician. And if they're not able to comply with the court's order under the care court program, then they might be subject to a conservatorship. So the governor has been clear about his support for conservatorship for the most severely mentally ill, and I support him in that. And it is, honestly, it's anathema to me that more policymakers have not done the homework on this to understand that the governor's right and that and to agree with what I'm saying, that we need to make the resources available to treat people who are sick.
Do you think people are fearful that government would have an overreach? I mean, I know you explained the
Absolutely.
very difficult process it takes to do
Right.
conservatorship, but is that do you think that's the reason why people are
Absolutely.
reluctant to talk about that as an option, because of the possibility
Yep.
for government overreach or for someone to get into a conservatorship who shouldn't be? That seems to maybe be
100%.
why.
That's absolutely
Yeah.
the reason. And, I would tell you, we're going to make mistakes. I know we are. But I think we're in a lot better position than we were in the the early 1980s when Geraldo Rivera went into Willowbrook in New Jersey and exposed the wrongdoing in the mental institutions there. What happened in the early 1980s, people loved to point fingers. Was it the Democrats or the Republicans or Reagan? The truth was we had a Democrat majority in Congress and we had a Republican president who looked at the national outcry about Willowbrook. And this is, if people don't remember, this is what made Geraldo Rivera very famous, is that he was the one that exposed the nation's mental health hospitals. He was actually invited into the hospital by practitioners and clinicians who were very troubled by what was happening there. And he told the story about how there were 4 children in one crib and there were patients that were strapped to gurneys in the hallways and the inadequate level of care. In the 60s, 70s, 80s, and maybe for hundreds of years. But think about what our level of understanding of mental disease was just 40 years ago. We didn't have compassion because we didn't understand mental disease.
I feel like even in the last 10 years, there's been an incredible leap
Absolutely.
around that understanding.
I think the understanding that a very large number of us suffer from, or do during our lives suffer from different mental illness, whether it be a bout of depression or a severe mental illness. And I think also what's so important is that people are finally willing to talk about the fact that most of our families have been impacted by mental disease. And, our willingness to talk about things really helps us to solve these problems. But I think also, we have a completely different expectation of care for those who are suffering from mental illness today in 2023 than we did 10 years ago or 20 years ago, and certainly a different expectation than we did 40 years ago. So, we threw the baby out with the bathwater. Congress in the early 1980s ended federal funding for institutes for mental disease. In 1963 or 65, when Medicaid and Medicare were adopted, there was a provision that prohibited Medicaid reimbursement for any institute for mental disease with more than 16 patient beds. And the reason for that was because Congress was federally funding through a separate bill funding for mental hospitals. So Medicaid said, this Medicaid is not going to be for mental disease.
That's covered over here.
That's covered over here. But then in the 1980s, Congress just eliminated the funding, pulled the wool out, pulled the rug out from underneath our nation's mental hospitals. And, probably that was the right thing to do. And everybody agreed. The system of mental hospitals is broken, maybe irreparably so, and we need a complete reset. But what we did is we sent a lot of people home. And what happens when your 25, 30, 40-year-old child is suffering from severe mental illness? How do you, as a 60, 70, or 80-year-old parent, cope with somebody who may have behavioral disorder, may be violent, may be erratic? How do you provide for your child that needs some of these supervisory mental, health services? How does a parent provide for that? And I have, some of the most heartbreaking conversations I've had with people that live in Vista are the parents. One of the things that always comes up is, well, you're just inviting all these people to come here. And I can tell you about 75% of the people that we ask everybody where they were homeless first and where they were last permanently housed. About 75% of the people that are homeless in Vista were permanently housed. They were living in a permanent housing unit in Vista when they became homeless. So homelessness is not just a problem where people are being attracted to Vista, but it starts in Vista. And people everywhere become homeless. But that's something that always comes up. So I always want to share that information with people, because I think it gives us a little bit more compassion when we don't imagine that it's just people coming from elsewhere to utilize the services that we're offering.
And we're talking about a very specific portion of people who are homeless in this, what you're talking about, because there are people who lost their job. Absolutely. They were 1 or 2 paychecks away from not making rent. I mean, there have been times in my life in my 20s where if I had lost my job, I don't know what I would have done next, right? So I think we can all relate to that. But what you're talking about and there are a lot of services for folks like that, right? To help them bridge to the next thing. But what you're talking about is those very seriously chronic homeless folks who need that next level.
That's right. We refer to this population of homeless persons as chronically unsheltered, which means that for 12 months they've been living outside without shelter. You make a very good point, a very important point. We have Solutions for Change. We have Operation Hope. We have a lot of other great organizations. For the individual who's homeless and does not want to be homeless, we are able, because the resources are there, I promise you they're there, okay? For the person that will accept the help, we are able to do amazing things, and the resources are there. And we've got a lot of great people in our community that have recovered from being homeless. And there's a place available right now for families who are homeless and don't want to be. The real challenge that we face, and the problem that the public sees every day, are the individuals who are living on the streets, who are primarily addicted to narcotic drugs. About 95% of them are addicts. And there's this enormous debate. I don't know why. I'd love to hear the person who disagrees with this explain why they do. But there's a huge debate about the role that narcotic drugs play in chronic unsheltered homelessness. The reality is, and anybody who spends time in the encampments knows, that it's about 95% of the people living in those encampments are addicted to narcotic drugs.
Is the debate that there's also mental illness? So is it kind of a chicken and egg situation? Are you mentally ill because you use narcotic drugs, or are you using narcotic drugs because you were mentally ill?
And here's
is
another...
Is that the question? Is that the debate?
It's part of the debate, but here's why, to me, it doesn't matter.
Right.
The American Psychiatric Association defines narcotic drug addiction as mental disorder.
Okay, there you go.
So if you're addicted to drugs, you're suffering from a mental disorder. It doesn't matter whether you have co-occurring morbidity of, being a psychotic, severe bipolar, schizophrenic. These things are all mental conditions that, once you become a heroin addict, maybe before you were an addict to heroin, we could say that you had control over it, right? But once you become addicted to methamphetamine or fentanyl, the person has lost the rational choice capability to say no. They're suffering from a mental disease. Why would we not give parity in our minds to the way that we would serve and treat and provide for somebody who's addicted to fentanyl and can't make a rational decision to stop using it? Why wouldn't we give that person the same love and concern that we would somebody who is not addicted to narcotics, but who is simply, in a state of psychosis? Right. I mean, if we're going to be serious about loving people and treating people and helping people who are mentally ill, then we have to all acknowledge that addiction is a mental disorder, and we have to treat it as such. So, why we're in this big debate over whether or not narcotic drugs are playing a major role, I can't understand, because it's as obvious as the nose on our face that it is. But yet there's this unwillingness to confess and admit that. Yeah. And I don't understand it. I really don't.
I wonder if it's that when we say homelessness, it refers to this entire spectrum of people.
Sure, maybe
like
that's
the mom and 2 kids who were behind in rent, and all the way to the very seriously mentally ill.
And of course, I'm only referring to the chronically unsheltered people.
Of course, but maybe people think about this category, and when you talk about addiction, they think, oh wait, you're applying it, but it's not applied to everyone. It's applied to this very specific subset, essentially.
That's right.
Yeah.
Because we're so successful at serving the families and the people who are homeless, but who are not chronically homeless, because we're so successful at helping those individuals, what we're doing is working so well. I mean, that's the enormously bright spot of success. If you lose your housing because you lost your job, you became sick, the services that are available are incredible. And I know that you and I have been recently in the last week or two, we were at the grand opening together of the pantry at Operation Hope.
Right.
The services that are available. I mean, I always want to remind people about the food bank in the business park. There's a beautiful grocery store that is open and everything inside of it is free. If you are hungry, if you're in need, you walk in and they ask you to self-certify that you're a person in need. And they're
not looking at your bank statement.
They're not asking for you to come in with page stubs or anything. If you're in need, you can go to the North County Food Bank and you can pick up fresh produce and diapers and baby formula and whatever you need. And they have a huge assortment. And it's not just enough that they're in the business park. They're also working with hundreds of small partners that have small community food banks. And what's great about what Operation Hope is doing is they said, we're going to bring these resources right here to the women and families that we're serving at Operation Hope so that they don't even have to go to the main food bank facility. They don't have to meet someone new, suffer any embarrassment. We're already working with these people and we can connect them with those food resources right there. So the resource, and we all love to tell the story about the organizations that are serving family homelessness needs because they're doing such a great job and they're so effectively meeting the needs. And of course, more is always needed, right? Shauna and I give $50 every month to Operation Hope. We have for many years. And I encourage everybody, give $5, give $10, give $15, whatever you can afford. Give something where we've all, those of us who've been fortunate enough to be employed and have a safe place to live, we can all afford to do something to help people who need a hand up, right? Absolutely. And so that's why I think it's important, even if it's a small amount, to do something every single month, just to recognize that that's got to be a part of our obligation to serve and help other people. But the frustration sets in when we talk about this group of chronically unsheltered people, because those are the ones that we see every day. Those are the ones that are living on the street. Those are the ones who are suffering from the greatest health consequences. So,
and they're the ones that die.
Absolutely, right. They're the ones that are the greatest risk of death from their situation. So we could obviously talk about this, and I would love to come back and talk anytime.
Yeah.
And I invite people that have a perspective. If you're listening to me today and you strongly disagree with me, call me 689-2220. Tell me. Write me an email at jfranklin@cityofvista.com. I want to hear from the community members, and I'm barely smart enough to know that I'm not right all the time. And if somebody's can educate me, I'm a lay person. I'm not an expert on homelessness, but I'm trying to become one because I think that I need to help solve this problem. But if somebody's got a different perspective, I want to hear it. I want to learn. I'm open-minded. I'm willing to always hear my colleagues and service providers. And I think very important. And one of the most important things I do when I meet people in the encampments and I get them a referral, I go over and I visit them, whether they're at the motel or they're at the shelter. And I have told many people this. I give them my business card and my cell phone number, and I say, I can't go live in the shelter with you. I can't go through the experience that you're about to have with you, but I need to learn from you. So will you call me from time to time? And can I come visit you? And will you tell me what you've gone through? And I've done this with a number of individuals so that I can get a firsthand report of what's working and what's not working in the shelter system. Because without that firsthand information, I wouldn't be, as well informed as I am about why people are leaving the shelters, why they don't stay, why we're not able to get them transitioned into permanent housing. But it's super important to get that granular information, and that's what I'm trying to do. So whatever your experience with homelessness is, reach out, call me, let me know. I want to hear from you.
Hey, wow. Gosh, I had so much on my list to talk about, but I'm glad we dug into that topic. So
it's so important. I appreciate the time.
Of course. And I know we're getting close to the end, and I know you have a very busy day, but I do want to ask you on a more lighthearted note. Yeah. The city's turned 60 this year. Yes. There's a party coming up.
That's right.
Tell us about it. Do you have any info? We'll put it in the show notes.
So go to thecityofvista.com.
Okay.
We should have it soon up on our webpage. I think the date's October
14th.
October 14th. Yes, I'll be there, and we're going to have a big party, and we hope that as many people as possible can show up. We're going to have some performances and some opportunities for the whole family. So, yes, I'm sure the Chamber will probably be helping us with it.
We'll be there. Mm-hmm.
Great, and hopefully you'll be promoting it on your website. And so if you want to give people a link to it.
Absolutely.
Yeah. And maybe you and I should do a promo video soon.
I would love that.
Just to promote that event.
Absolutely.
That would be great.
Absolutely. Okay. So I wanted to ask you, if you have just another quick minute, what advice do you have for someone potentially who's interested in serving their community as an elected official? Do you have any? Just show up. Okay.
Come to the council meetings. Come to the commission meetings. Speak up. I have long had a saying, which is, governance and politics belong to those who show up. And anybody who's ever taken the time to come and speak at a council meeting knows we are paying attention, and we are very much listening to what the public has to say. Everybody has 3 minutes to come and speak on any topic that they want. And we take it very seriously when citizens come and tell us what they want. This recent park that we've acquired, citizens didn't want a hotel. They didn't want condominiums. We listened to them. We married that with our goal of acquiring more parkland. And we decided to buy some land and take it off the development map. And we're very proud of the outcome because we believe that creating a park in that neighborhood was needed. There's thousands of apartment homes nearby. So we're looking for those win-win opportunities. But when citizens speak up, when they tell us what our blind spots are, it's very helpful. We're, as you mentioned, our council is a council of lay people. We're a part-time council. We are the board of directors for the city. Our city manager is our chief executive of government. And so we're sort of, we're providing that supervisory oversight. We really need to hear potholes, graffiti, report them on Access Vista, or send me a text, or give me a call, or call your city council person. We will get on those things. Somebody called me recently and said, why it's so hot at the skate parks. Why is there not a drinking fountain? I didn't realize we didn't have a drinking fountain in the skate parks.
Wow, I didn't either.
Yeah, and so I've got the city public works director investigating the possibility right now of putting some drinking fountains in. Those suggestions that make things better come from the public. So get involved by showing up and speaking up. Those are the two most important things you can do.
I have to give a plug for the Access Vista app.
Yes.
I use it. I'm probably annoy people because I report things. I'm driving around town and I see something and I'll put it right in Access Vista. It gets addressed. So we'll make sure to put a link for that in the show notes. Yeah. I want to thank you so much for being here. I do have a couple of quick questions. Yeah. My rapid fire, I always end every interview. So I want to ask you a book you think everyone should read, or a book that was particularly powerful for you.
How to Win Friends and Influence People by Dale Carnegie. It's an oldie but a goodie. I think one of the most important things I remember from that book is that people remember a conversation the best where they did most of the speaking, like I did this morning. I'm sorry. But it's about how to listen to people and how to make them feel heard. I think that's one of the most important books I've ever read in my life.
Well, that's a great book. I've read it a number of times, and I know it's been such a popular book that it spawned educational things for kids and for teens and college curriculum around that. So it's a really powerful book. I second your suggestion of reading that, and also second your suggestion of listening. One of the reasons I love doing this podcast is because I get to listen to people and their stories and what's important to them. And then I help amplify that perspective among our listeners. So thank you all for listening. So I want to ask you next a song. You got to turn it up. Yeah. Is there a song that you love or that's moving for you?
I have a really eclectic taste in music. I mean, everything from Mozart to rap. I'm serious. I really love music. And there's not a genre that I don't enjoy. But lately, I was thinking I would tell you, I've been listening to a lot of Johnny Cash.
Okay.
But, again, I'll hear something on the radio. I mean, I like some pop music. I probably am a little bit more partial to older music.
Okay.
But I love all kinds of music. So, anything with a good beat. And I like it when you can hear the words and there's a story, right?
Okay.
I love story. Jim Croce, I'm a big Jim Croce fan.
Yeah.
Anytime there's a story and there's deep emotion in the song, that's what I'm looking for in music. I love that.
So you want to have that connection.
Absolutely.
Okay.
I want to, I want to see I want to see a picture in my mind when I'm listening to music. I really like that.
Okay. Tell me something that inspires you.
Something that inspires me. The young people in our community. The Chamber of Commerce is such a great program with the Rising Stars, to see those young people, to see the emotion that their parents have, and for all of us in the room to be reaching for the tissue because these young people are just so inspiring and motivational. But not just at the Rising Stars program, but every day in our community, I see young people, whether it's kids playing in the parks. I love, and a lot of what I do is for the youth in our community. That's one of the reasons that I said acquiring more parks needs to be one of our top priorities, because Vista and the state of California, we're growing, and this is a whole nother political subject, but we're being forced by Sacramento to densify, something I don't necessarily agree with. But as we become more dense and there's a pressure to grow vertically, I'm looking at New York City going, how important was it that they carved out this massive Central Park and all the smaller parks in New York? And I think it's a great legacy that I hope to leave, that we create more parks in the city of Vista, so that every family, particularly some of the more economically disadvantaged communities that have a lot of younger children, I want people to have a place to go and sit on a piece of green grass and enjoy being with their families. That when I see that makes me so happy. When I go to Bub Williamson Park and see families having big gatherings there and enjoying that outdoor space, that makes me so happy.
That's awesome. I have to tell you, Palo Vista Park is nearing completion.
Yes.
It's looking really good. Every time we drive by, both of my kids, even my 13, almost 14-year-old, she'll be embarrassed I say this, every single time. They're so excited. They can't wait for it to open. They want to go check it out. So that's great. And I also want to just say quickly about Rising Star. This is the 10th year for that program. And we just wrote an article in the Vista magazine that just came out, the August edition, about some follow-ups with some of our past Rising Star students. And so I encourage people to check that out. Okay, last question for you. Tell me a Vista business that deserves a shout out.
Well, I love to eat, as you can see. We got a lot of great Italian restaurants. I love the Nucci's family. They're all literally becoming family. It's been a favorite place to eat for a long time, but Sam and Lisa are the owners there. Their son, Michael, is actually engaged to my sister-in-law. So, we're literally becoming one family, but I love the food there, eat there frequently. So you can find me some nights of the week having dinner there with my wife and family.
That's great. And the Nucci family, they're very involved in the community.
Yes, they are.
Sponsoring different sports teams and things like that. So that's a great suggestion. Well, I want to thank you so much, Mayor Franklin, for being here. Thank you for joining me today. I really appreciate your time. Yeah. Thank you to our guest, Mayor John Franklin, and thank you for listening to Velocity. If you like what you heard, please subscribe and tell a friend. Help us move Vista forward with Velocity. The Vista Chamber of Commerce is a nonprofit organization that serves as a catalyst for business growth. Find us online at vistachamber.org.